Well, hi, I'm Senator Patty Murray from Washington State. Great to follow my good friend Tammy Duckworth, who's just an inspiration to all of you. Okay, I'm taking a question from Judith from Instagram. Is it true that the bill delays actual cuts to Medicaid and Medicare until after the 2026 election? Well, that's a really good question. In order to make this feel better, what the House Republicans did before they passed the bill is they put in some of the really detrimental parts of Medicaid to be enacted after the 2026 election. Of course, they don't want their constituents to say they did this, so they think that by doing that, it kind of hides the ball and nobody will really feel it. But the fact is that actually these cuts to Medicaid will be felt by everyone before the election. So I don't know what they were trying to cover up. Let me tell you why. Because the cuts to health care in the House passed reconciliation bill will start to be felt as everyone begins to implement them. And health insurers for everybody, not just for Medicaid and not just for people on the ACA, will start having their actuaries say, what is this going to cost me if a bunch of people lose their health care? It's going to cost me more because more people will be going to emergency rooms and hospitals and doctors that don't have insurers. So as an insurer overseeing this, I'm going to raise my rates for everybody so I get covered. So everybody's rates are going to go up that has insurance right now. If you're not on Medicaid, not on any of the ACA, your rates will go up. So I don't know why they think they're hiding the ball, but yes, in the bill itself, they had the actual, many of these requirements go into effect after the election in 2026. Okay, I'm taking a question from Sandra from Facebook. Trump says we're not changing Medicaid, just cutting waste, fraud, and abuse. Yet 8.6 million may lose coverage. Fraud is already illegal. Why not enforce the law instead? Oh my gosh, I wish everybody was saying that out loud every single day, because I love how Republicans always say, oh, we're going to cut education, we're going to cut healthcare, we're going to get rid of all this waste, fraud, and abuse. Well, I can tell you, as someone who's been here for a long time, worked on many budget bills, healthcare bills, and everything, I have heard all this talk about waste, fraud, and abuse, but I haven't seen any evidence that it is going to actually save us billions of dollars. Sure, any program, anywhere is going to have people that abuse it. But we go after them right now. It is illegal, and those people are held accountable, or those providers, or whoever is trying to take advantage of the system. Yeah, we need to enforce that, but you know what that takes? It takes people at the agencies who are following up on this and making sure that anybody who is illegally using or abusing any of these programs is taken care of. What did Trump do? He fired all those people. So what the Republicans have actually done is get rid of the people who actually can go after waste, fraud, and abuse. And then they put this bill forward saying that that everybody who's losing their coverage is somehow frauding the government. And the two of them can't be the same, and they can't be true. The fact is, the real fact is that this bill, this reconciliation bill, the so-called big beautiful bill, or as I say, this big beautiful betrayal, will actually make people lose the coverage they have. It will be horrific, and we need to speak up, and we need to speak up loud. Okay, the next question, Shannon from Instagram. What will happen when people lose SNAP and Medicare? Every one of us should be asking that. It's so easy to think that, well, okay, some people are going to lose their nutrition coverage, some people are going to lose their Medicaid, but it won't be me. I guarantee there will be someone in your life that this affects. 8.6 million people losing their healthcare coverage through Medicaid alone means that somebody's grandmother won't be able to stay in a nursing home. It means somebody whose child is extremely sick, who doesn't get paid enough or doesn't get health care through their provider, will lose their coverage. I'll just give you a great example. I used to teach preschool, and I can tell you, when one of your kids comes to school sick, everybody gets sick. So if we have a lot of people in this country who don't get health care, don't get preventive care, don't get the care they need, it will impact every single one of us. Okay, next question is Maddie from YouTube. Can you talk about why SNAP is so important? I'm going to tell you my personal experience with this. SNAP is a nutrition program. It basically says in the United States of America, if you cannot afford to feed your family, there's a little bit of help for you, not much, but just some basic nutrition that your family can get so that we don't starve people in this country. I know this personally because when I was in high school many years ago, my dad was diagnosed with multiple sclerosis and he lost his job. 7 kids in my family. Now, my mom had been staying home. She didn't have any job skills. She had to go out and get some skills and get a job. So there were several months where we had no income, 7 kids. What happened? We had a nutrition program in this country that for a few months helped put food on my family's table. No one wanted to be, recipient of that, but it made a huge difference for my family. And it's one of the things that drives me every single day. We have to make sure that program is there. So families like mine, people that by, not because of anything they did, but because of circumstances in their lives, get that little bit of nutrition that they need so they can be on their feet. Why is that important? Because of the 7 kids in my family, we all grew up. We all now contribute back to our country. I have a brother who is a firefighter. I have a sister who's a teacher. I'm a United States Senator. We wouldn't be here and be able to do our jobs if our country wasn't at our back. SNAP, Medicaid are programs that are at our backs when we need them. As a country, we have to make sure they're there for others. Okay, this is for a creator, Rachel Bender. Good to talk with you. She has an audience question. How will current student loan plans be transitioned to this new student loan plan in the bill? Well, good question, and I have no idea. First of all, we have a president who is bound and determined, along with his education secretary, Secretary McMahon, to dismantle the Department of Education. What does the Department of Education do? One of their critical things they do is manage the student loan program. Well, now they've fired or gotten rid of all the people who manage that. And now they're talking about a new student loan plan with nobody who's going to plan, organize, make sure it works, get information out to people, process claims. I have no idea how this administration thinks that they can accomplish anything without the people to do it. And by the way, I think that's their goal. They want the program not to work. This is why we have to speak up really loud. Okay, this is Lori on Facebook. Can you give an example of how much money Medicare cuts consequent to sequestration would affect an individual average Medicare beneficiary? Well, first of all, the House passed this in the middle of the night. Everybody's just starting to understand it, including Republicans who have failed to read it before they voted on it. And I don't think anybody really knows the answer to that question. We are going to look at and see what the Republicans in the Senate put forward. But the broader answer to your question is the way that the House wrote this bill, it will impact everyone in our country in multiple ways, including people on Medicare under this perverse provision called sequestration, which means if you hit a debt limit, then everybody across the board gets cut. That actually will go into effect next January. So don't let anybody tell you this doesn't touch Medicare. It will. Shannon from Instagram, what will happen? Oh, oops, hold on, I'm getting another question here. Okay, Susan Lambert, how are Senate Dems celebrating Pride Month? Oh, good question. I think many of our Senate colleagues are out in their states attending Pride events. I just did a video for a big, huge event that occurs in Seattle. I think many of us are watching how this administration has just gone after anybody who they think is outside their norm. And that includes many members of our LGBTQ community. I've talked to so many of them who are really feeling vulnerable right now because of these attacks. So Senate Dems, many of them, including myself, are standing up, standing proud, and standing beside all of our members of the LGBTQ community this month. Okay, Annie from Instagram. What are the Democrats' plans to usher in young and upcoming leaders into the legislature? This is really important question, because I hear from too many people who say, I don't want to be involved in politics. I would never choose that as a career. Who would want to do this? For a lot of reasons, having to raise money to run for office, all of the criticism you get from everybody. If you've been on X, you know that we all get those nasty little messages back, and they're going, why would I want to do that to myself? Well, what I would say to every young person out there is that this is your country, whether it's your community and you want to serve in a school board, whether it's the city council, whether it's your state legislature, or even here in the United States Senator. What I can tell you is if you sit at home and gripe about it, you don't make a difference. But if you go out, get involved, have your friends help you, run for office, that's how you make change. So I think one of the most important things we can do is inspire young people by fighting today, by telling them they can make a difference, showing them they can make a difference, and personally involving them in our offices. And we all try to do that. But I would say to any young person out there, don't you be one of those people who just says, I'm going to give up. Don't say you don't care. You do care. This is your country, your community, your family, your future. Get involved, run for office. You can make a difference. Okay. I know that my friend Jeff Merkley, Senator from Oregon, I'm from Washington, he's from the state right below me, is going to be here shortly, and he has been a great member of our Senate family. He heads the budget committee, which sounds kind of boring, but it actually determines where our money is going to be spent, much like you and your own budget, whether you're a family member and you decide whether you're going to buy a house or rent a house, or how much food you're going to spend, or whether you're going to go to the movies. That's all in your budget. And Jeff Merkley is our budget leader here in the Senate Democratic Caucus, and he helps us make decisions about what we invest in to make our country stronger, and fights for them every day. And I'm very proud to turn this over to him right now. So, Jeff.
Great, thank you.